So thank you for being here again this morning with us, Rob. Rob is here to talk about developmental trauma and the developing brain. So we've had Dr. Meeder here all week, and we have him here tomorrow as well, which has been wonderful. There's been a lot of interest in the childhood mental health topics, so we are very fortunate to have Rob with us here today. Now, this session is sponsored by Wave Electric. Wave has been a long-time sponsor of the Mental Health in Motion event, and we are so thankful that they jumped on board with the new format and with the A Week to Be Well session. So thank you so much to Wave Electric. And we also have Midland Honda and Brissett Concrete and Forming that are the sponsors for this entire week. So all of our sessions are free, and a big part of that is because of the help of our sponsors. And if you are interested in the chat, we've just put the link to the donate button for the COVID-19 Mental Health Relief Fund. So if you can, any donations are sincerely appreciated. They help us deal with some of the mental health challenges that have arisen as a result of COVID-19. So thank you so much. And Rob, I will let you take it away.
Okay, thanks so much, Holly. And thanks everybody for joining us again at new time, same place. I think this is an exciting area, obviously, and I wanted to just express my excitement about Waypoint really going in the direction of child and youth mental health. I think it is just such a natural thing to think about mental health as not something that just pops up out of the blue when you're 20 or 30 or 40 or 50, but really recognizing that many of the issues that develop later on in life really have their roots in childhood. And I think understanding that and kind of changing the lenses a little bit around childhood experiences, I think is just so valuable. And I think for Waypoint to embrace that and to recognize that and to go in that direction, I think has just been fantastic. And I think it's going to pay off huge for all of our patients and our community down the road. There's so much we can do in childhood that will have lasting beneficial impacts years and decades down the road. I've mentioned this many times already in my previous talks, and the same themes keep coming up over and over again. So you might hear some phrases and some points again today that were brought up in previous talks. If this is your first time joining us, it will obviously be the first time you're hearing it. And I hope you'll be struck by, I think, some of the real importance around some of these key learnings that we're going to talk about today. So today is about a concept called developmental trauma. And I'm just going to share my screen now and get that up for you guys. So says I'm screen sharing now, and we're just going to go to play here. And again, I'll just you should be seeing my screen now. And since I'm not hearing anything from anybody to the contrary, I assume that you're able to see what I'm seeing, which is a title slide called Developmental Trauma, and our familiar turtle and fish to convey a sense of serenity and calm this morning. So yes, so let's talk about this, because this is that interesting concept that I think threads its way through all the talks this week about how adverse childhood conditions can really be in the background of many childhood behaviors that we consider difficult or problematic, or which lead to diagnoses of particular disorders. We talked about ADHD already, so that hyperactivity, impulsivity. We talked about anxiety and how that manifests. Autism, maybe not so much in this trauma category as being, a subsequent result of that, but certainly, can be go along with that as well. So attachment certainly is something that, might be part of the autism spectrum as well. And so this might all relate. The nice thing about this topic is that we have lots of pictures, and that will emphasize the points I'm making. So here is the first picture. I think we have the privilege of nerding out a little bit today by some discussion just about how the brain forms and some of the science and neurobiology around that. I mean, it is just amazing how a child's brain forms and the rate at which that happens and the incredible complexity that is created literally within weeks of formation. And, we all know when, a sperm and an egg comes together, we have this fertilized egg, and that splits into 2 and then 4 and then 8 and then 16 and just kind of multiplies from there. It becomes a little ball. And then for some reason, through some complex genetics, just based on sort of where certain cells are located on that forming what we call blastocele, or that little ball of cells, it starts to take form, it starts to take shape. And I don't know I don't know it's gravity or whether it's some kind of sense of direction, but somehow various cells start to differentiate or change into the various precursor cells for all the different parts of our body. And that same genetic code resides in every single cell of our body. We got half of it from mom and half of it from dad, and it all combines to form our own unique genetic code. Identical twins, of course, have the exact same genetic code. Fraternal twins are like siblings, so they're different combination. But that genetic code then really prescribes how all that formation takes place in this incredible sequence with incredible precision. I mean, there's such sensitivity to environmental conditions and, genetic mutations when they happen or randomly or whatever, and that can really alter that path of development. So the fact that it happens so well and so precisely so many times is, it just borders on the miraculous. So we have this ball that becomes this shape, and then inside that shape there are some cells which eventually become the nervous system, and it's usually just a little cord at first, and then that becomes sort of this tube, and which becomes your spinal cord. And then at the end of that, we get what eventually becomes the brainstem. And that sort of becomes the scaffolding for subsequent, neurological precursor cells to form the midbrain. And then here we see that picture, we see that 13-week picture there. We see formation of the spinal cord on the bottom. And then, we have the outlines of all the various, base parts of the brain. That becomes like the midbrain, which regulates things like, emotion and memory, and our more primitive reactions. I call it the lizard brain. I think I've used that analogy in a previous session already this week. Sort of that fight, flight, fear response, like the things you need to survive. And then that then gives rise to the outer part of the brain. You see at 26 weeks, all those little, fissures are just starting to form there. And then by the time the baby's born, the brain really resembles what it's like a miniature version of what we commonly see in the models of the brain. And so this cortex starts to form, and the cortex, that wavy, jello-ish part of the brain, is what gives rise to complex things like planning and language and motor coordination to do fine motor movements, our ability to coordinate activities, to develop empathy and take other people's perspectives is really housed in that outer layer of the brain. And the reason I want to go through all of this is just to say, like, there's so much formation and transformation that happens in those first 40 weeks, and then an explosion of development that happens literally like in the first couple of years of life. And you can imagine that when all of that is taking place, if we start to kind of knock it off its path, or there are stressors induced during that time of formation, you can imagine that kind of knocks things off, for everything downstream as well. It's like when an airplane takes off and it makes this minor deviation in its course at the beginning, the final destination is going to be hugely different from, if that deviation happened while it was making its landing. And so, when the brain forms as well, small little, what we call insults or, redirection can have huge impacts, as the brain moves on towards its more final formation. So all of that development is just goes at a breakneck speed in those first few years of life. Then it kind of slows down, and then the cement starts to dry. And like they say, you can't teach an old dog new tricks. It's tough for us to learn new things as we get older. We know that because these pathways are formed. They're not like fully formed. There's still lots of potential to learn and make new pathways, but it gets harder. It's why it's so easy to teach a baby a second language and a third language. And if somebody learns a new language after, say, the age of 12 or 13, they always have an accent. And you may have I have a little bit of an accent, and it's actually because I grew up speaking Dutch. I spoke only Dutch until I was 9 years of age. And I have a friend who moved to Canada at about 13 years of age, and he has this very strong accent. You wouldn't be wondering, like, what is that accent? And so and we know that kids who are, who go into French immersion, for example, even if the parents don't speak French at home, if they go into that program, at 5 or 6 or whatever, JK grade 1, kids just pick up the language. I picked up English within a year and spoke fluently with English within a year when I moved to Canada. Whereas, my parents are still have a very strong accent. So that's because the brain was still very open to being transformed. We say that it was still quite neuroplastic, okay? Plastic meaning it was moldable. It was changeable. It was open to learning new things. And so that's kind of how the brain forms, and then it results in this sort of final shape here. And here are some structures that are just key when it comes to behavior, especially when it gets to dysregulated behavior. Again, these are some things we talked about, kind of pointed out earlier on. And here we are. Here's the prefrontal cortex, which we talked about, I think, yesterday or the day before, as being very much involved in executive function. That is like, planning a task, staying on task, completing a task, inhibiting impulses that might distract you from your task, communicating what you're trying to do. So that is the prefrontal cortex. It inhibits impulses. It prevents you from kind of acting before thinking. It lengthens your fuse when you feel upset or angry. So when that hippocampus, see that little part there in the bottom of the brain there, and the amygdala, when they're sending out signals going like stress, 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 react, react, the prefrontal cortex might say, whoa, 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 just because, your teacher said you can't do that, that doesn't mean that your life's in danger. Maybe you just need to just think about this, and there might be another reason why your teacher says you can't do that. Like maybe it's recess time, or maybe recess is over, So we have this ability to regulate our emotions and regulate our behavior as we go through life, because our cortex is our kind of human part. It allows us to exist in community, in society, without sort of constantly flying off the handle and acting, as we might in the spur of the moment when our life's in danger. That was great, like thousands of years ago when we were escaping wild animals in the jungle, but it's not so great now in our more complex way of life and our society, which has transformed over the last hundreds of years. But our brain is still kind of sometimes reverts to back the way it was thousands of years ago, which was different. So how does adversity affect that brain development? We already alluded to this. And what we know is that adverse stressors, so whether that's, exposure to toxins or exposure to psychological stressors, it induces what we call a stress response. And that's, again, that is good when you're running away and you're trying to flee and you're trying to survive, okay? Because that needs to act like right away. It's a life or death thing. So our brain interprets a threat, and it sends these signals to the hypothalamus and the pituitary gland, which then activates the adrenal glands that sit on top of your kidneys, and that just pumps out adrenaline and cortisol. And that's great. Our body needs to get ready, needs to prepare itself for this oncoming stress. That's called the HPA axis, or the hypothalamus pituitary adrenal axis. And it is activated whenever we have stress. So that releases cortisol, and cortisol readies and mobilizes our defense mechanisms. If this happens with a mom, when a mom's expecting, that cortisol also crosses the placenta. It's a small molecule. It crosses in the placenta and also actually affects the developing baby's brain as well. And then this stress response system actually also works for toddlers and for small children. So they are also responding to these stressors by producing cortisol. And then that feeds back to the brain. And in fact, it feeds back to the developing brain. And what we know now is that stress hormones are not great for the developing brain. They get us out of trouble in the immediate situation, but when it comes to longer term impact on developing brain, whether it's in utero before the baby's born or afterwards, this is not a healthy substance for brain formation. So what are adverse experiences? Well, we talked about this a little bit already. We talked, toxins and things like that, but other psychological stressors, accidents and natural disasters, children who may have lost parents, even if it's by sickness or other reasons. This can be a significant, obviously, adverse experience in a child's life. War, we see many kids who have to live through violence and conflict, who have seen things they should not have seen. Terrible stories of, child soldiers, children being standing by literally helpless in war situations. They are traumatized by those experiences. There's no doubt about it. Medical illness. So going through chronic illness as a child can be a significant adverse experience. Obviously, I've looked after many kids who have gone through cancer and cancer treatment, lots of procedures and sometimes painful procedures that they have to endure. That is not, something that a child should have to live through and be expected to tolerate. There are impacts of that. Trauma is particularly toxic when it's what we call interpersonal, especially when it's trauma that's inflicted by someone who should be in a caregiving role, and there should be trust there. So in child abuse and neglect, which often happens in a context of a child and caregiver relationship, this sets up a huge cognitive dissonance and sort of just confusion in a child's mind about exactly what's going on. Community violence is another one. So children who grow up in dangerous neighborhoods, which exists sometimes in larger cities, that can have a huge traumatic effect as well. But then also more systemic adversity, racism, poverty and inequality. I'll put bullying in here as well, and cyberbullying, just things that make that impact a child's self-esteem and self-confidence, that belittle, that really make a child feel like they are not worth anything or that they have nothing good to offer. I mean, these are psychological traumatic experiences that can really impact a child's brain, and then their development, and in physical and mental health later on in life, which we'll talk about now. So I want to distinguish between, tolerable and positive stress, because nobody's life is stress-free. We all experience stress to some degree, but there's a difference between tolerable stress and toxic stress. okay? Toxic stress is usually more extreme and more prolonged, or takes place in a setting that is very confusing, or in a relationship that is just confusing for the child, especially when it's interpersonal trauma. So good positive stress is like, having a deadline coming up for a test, for example. That's stressful. We see students go through that. And, that is something that exercises the brain. It kind of makes you stay on task. It keeps you motivated. That's good stress. All right. Having to go to school for the first time, getting off the bus and saying bye to mom or dad. I mean, that is stressful for the parents, but it's also stressful for the child, usually. But that's good stress. It prepares you, it develops you in a positive way. It moves you towards independence, moves you towards, learning new skills, and it makes you productive. That's great. It builds resilience. So if you can handle small stressors and thrive through those, then you could probably handle more bigger stressors later on in life as well. So that we see kids who are resilient, who actually subsequently might face some less tolerable stressors and cope, and have developed coping mechanisms. In other words, they are resilient. They are able to cope with even big stressors later on in life because they've developed ways to adapt and to cope to stress. But it's toxic stress when a child is not able to cope, when their coping and adaptive and defense mechanisms are not able to meet the demands of the stressor that's being put in front of them. So that's what that is. And toxic stress is most damaging when it occurs early on in life. And I've shown this graph already in a previous talk there, just showing how much brain growth happens in the first few years of life. That is when the brain is most sensitive to stressor, whether it's physical or emotional or psychological. And we have to ask ourselves, where as a society are we putting our resources for healthy development? And I like to think that it's shifting more and more towards those early years when we can have the most impact, so that, we are not catching all this stuff downstream when a lot of the damage is already done, and when we've seen already a huge impact on a developing child and that cement is starting to dry. So, as a society, we should look at, well, where can we put more of our resources so that we can really minimize and mitigate some of the suffering that could result from trauma that happens early on in life. Something to think about, and that's something we'll talk about towards the end. I want to bring your attention to a study called the ACE study. Now, this, to be honest, was like one of the most amazing studies that I'd never heard of before, until a few years ago. When I was a resident going through pediatrics, it's a while ago now, started my residency in 1999. I was class of 99 at medicine. So my residency was 1999 to 2003. I actually had not heard of this study. It was around that time that this material was coming out. And it wasn't until a few years ago that I heard about the ACE study. You may have heard of it. ACE stands for Adverse Childhood Experiences. And this study arose in the West Coast, United States. And it actually, interestingly, arose from a physician who was working in a obesity clinic. And so there was a lot of work at that time about, like, how do we, impact the growing epidemic of obesity and its subsequent association with numerous health conditions. And so there was a lot of work being done on that, and there were clinics set up to help people who really were struggling with obesity, and how do we impact that. And it was in that setting that Dr. Felitti, I think it's Vincent Felitti, was interviewing some patients and recognized that some of them had he found this out almost by accident, that some of them had experienced significant, severe trauma in childhood, and that was the starting of their struggle with weight. And he's like, what's going on here? And subsequently found that adverse childhood experiences were in fact a common antecedent or preceding factor for subsequent physical symptoms, such as obesity or physical disorders. Not just that, but many others, as we'll see in a second. So if initially it was a small study, initially it was anecdotal evidence, then it was a small study, and then the CDC, the Centers for Disease Control in Atlanta, took this on and did a huge study, about 17,000 patients. And what they found was astounding. So they want to stay relatively focused and look at some specific types of adverse childhood experiences. So they're on the right there. So they looked at various forms of abuse and neglect. So physical abuse, emotional abuse, and sexual abuse. They looked at neglect, so physical neglect, so just an inability to meet a child's need. Emotional neglect, so just not supporting a child emotionally, and asking people directly about that. They also looked at other household dysfunctions, such as, significant mental illness in one of the parents, especially untreated mental illness, a child seeing their mother treated violently, divorce and separation, incarcerations, substance use, etc. Just things that you can imagine might really impact a child growing up in that environment in a negative way. And so they asked people, said, before the age of 18, did you experience any of these things? And what they found was quite remarkable. They found, first of all, that adverse childhood experiences in California, which was in this study was actually a relatively well-off, primarily white population. So this, of course, needs to be viewed in other contexts as well. But in this particular study, even here in that sort of more controlled environment, the findings were quite astounding. So as you can see, that pie graph to the left there, only about a third of patients reported not having had any adverse childhood experiences. About 2/3 had at least one. And, a good number, like 17%, had 4 or more adverse childhood experiences. So that's almost 1 in 5. And you can see there, the most common ones were emotional or verbal abuse that people might have reported experiencing before they turned 18. Parental separation or divorce was common in about almost a quarter, or it's over a quarter of individuals. And then it just goes on from there. So you can see, even sexual abuse, 1 in 10 individuals reported that they were sexually abused before the age of 18. And so this was eye-opening for people, but it was particularly eye-opening when we realized the association that these adverse childhood experiences had with physical and mental health later on in life. So for example, in that particularly high ACE group, so 4 or more adverse childhood experiences, if you had 4 or more adverse childhood experiences, you're about 5 more times more likely to suffer from depression as an adult. You are 4.6 times more likely to seek help from a mental health care professional. 4 times more likely to suffer from Alzheimer's or dementia later on in life. 12 times more likely to attempt suicide. 10 times more likely to use injection drugs. 7 times more likely to have an alcohol abuse issue than someone who has 0 ACEs. So you can see that there's just strong link, and this was dose dependent, we call it. So the more ACEs you had, the more the likelihood went up of all these conditions when it related to mental health. This was astounding. We had never seen such a strong link with almost anything else. I mean, even the link with smoking to lung cancer was less profound and extreme than what we saw with adverse childhood experiences and all these other conditions here. And it wasn't just mental health, it was physical health as well, because we know that cortisol has now been linked to weakening the immune system, causing heart disease through pathways of inflammation, increasing blood pressure. I mean, we kind of sense that already. We know that people who are stressed just tend to have higher blood pressure as well. But these stress responses, this chronic stress response, it just upregulates all of these chronic changes. And our bodies can handle, periodic stressors, but not chronic, prolonged, severe stressors. They really start to impact us physically. And all these different areas that you see around that circle there. So when you look at physical health, I mean, if you have had 4 or more adverse childhood experiences, you are twice as likely to have ischemic heart disease, 2.5 times almost more likely to have a stroke, 1.9 times more likely to have cancer, 1.6 times more likely to have diabetes. Like, wow, I mean, I guess we somehow thought of this, and now the pathways are being studied about how this actually happens biologically. But we know now that adversity, traumatic events, chronic stress in childhood translates to physical and mental health problems later on in life. And so, we need to almost take a step back and say, like, okay, how can we address this issue of adverse traumatic experiences in childhood? And maybe we just need to look at things differently, rather than just sort of taking a piecemeal approach to addressing certain behaviors. Like, whoa, what else is going on here that we perhaps could address individually in that individual, but just even as a society and as a community. So what does this all mean? Well, chronic trauma and adverse conditions interfere with the normal development of the mind and of the body. And trauma in development leads to an impaired ability for the brain and body to deal with that stress. And so that results in mental and physical illness. It leads to increased use of medical and mental health services, correctional services, and other social services. It puts stress on our educational system. It stresses families, obviously, to have to deal with this. And the idea has been brought up that we really need to consider developmental trauma as an actual disorder and as an actual diagnosis. And we start thinking about this, when we see kids present with symptoms of PTSD, post-traumatic stress disorder, and ADHD and anxiety, and it's just sort of becomes this alphabet soup of diagnoses. We need to take a step back and say, whoa, what else is going on here? I mean, this seems to be a lot of diagnoses to pile onto a child. Is this really helpful to look at it that way? Or do we need to think, okay, maybe this child is dealing with trauma and we are just seeing the tip of the iceberg and we need to go and address the iceberg. The bottom line is stress, sets us up in early life for a lifetime of suffering, which can affect then the next generation, because many of these kids, of course, grow up to be parents themselves. And we know that parenting is difficult when we're struggling with our own mental health and our own difficulties and our own physical health. And, that then can lead to difficulty with raising our own kids if we're still dealing with trauma and adversity from our past. So it's a cycle that just repeats if we don't do anything about it. So what can we do? What can we do? For children who have suffered trauma in early development, we have to recognize this as being a holistic condition. I think just treating this as, a behavior problem or a psychological problem, I think does a disservice to the child if we don't realize that this has affected them physically and mentally and spiritually, culturally. All right. We need to mobilize all of those aspects of healthcare and well-being in order to address such a huge concept as adverse childhood experiences and trauma. We need to restore in this child a sense of safety, and we need to remove things that trigger these stress responses. We need to give children a sense of agency, like they need to not feel helpless and hopeless. They need to have a sense of that I'm in control and I can change this. And children who are trapped in certain abusive situations, we need to help them. We need to help them so that they can sense again that they have some agency in their life. Anxiety usually results when we don't feel in control. If we give that sense of control back, we improve well-being. We need to provide a sense of calm. Kids who are triggered in traumatic situations, who are undergoing traumatic situation, they experience hyperarousal. That's part of what PTSD is about as well. They have flashbacks, they have nightmares, they have recurrent dreams. They are always in a constant state of tension. You can imagine how that feels. You just want them just to take a deep breath in and a deep breath out and to feel that relaxation. We need to restore that sense of calm and teach children how to get back to that sense of calm. We need to help them to process their trauma. to not feel like they're responsible for it, that it was their fault. Just being able to recognize what happened and to integrate those memories in a healthy way so that they can really move on from that and forward. And then we need to teach them different ways of coping than some of the maladaptive coping and defense mechanisms they may have established during or after the trauma, where they may dissociate or have numbing or really be hyper aroused and be stuck in this fight, flight, and freeze reaction. So we need to help them develop new ways of coping that is adaptive and that establishes a sense of safety and calm, as I mentioned above there. So, we need to think of, oops, I spelled developmental wrong, but we need to think of developmental trauma disorder as being an alternative to PTSD. It's more than just PTSD, all right? It's more holistic than PTSD. It also includes certain types of trauma which would not be ordinarily captured in the PTSD diagnosis. And we have to start thinking about, a disorder like developmental trauma disorder as being a better explanation rather than just lumping a number of different disorders in one. And rather than looking at a child and going, what's wrong with you? Changing those lenses and thinking more on, listen, what happened to you and how can we help you move forward from that? So that's trauma focused, that's trauma sensitive. And I think that's the direction that we need to go more and more when it comes to addressing children's mental health. In terms of prevention, I mentioned some of these things already, and this is my last slide. We need to promote secure attachment. There was a great study through Harvard called the GRANT study. It followed Harvard sophomores from the 30s and 40s, 1930s and 1940s. It's still following them. They're now in their 90s. And the common theme of like what translated to happiness later on in life, it wasn't income, it wasn't IQ, it wasn't what job you had. It was whether you had warm relationships in the early childhood years. And, right around that time when the study started, there was a lot of work being done in the area of attachment. John Bowlby did a lot of work on this. You might remember the monkeys with the wire frame and then the monkeys, with the warm, fuzzy covering in these lab studies where those monkeys, they preferred the warmness of a relationship as opposed to the wire monkey that just gave them food. And so, attachment is just so important to have for children, to have that secure attachment, to have that safe place where they can feel secure and they can be loved unconditionally no matter what. That is extremely vital for healthy psychological development, as opposed to an anxious, avoidant, or disorganized attachment that results in significant behavioral challenges. So oxytocin is one of those anti-stress hormones that gets released in warm attachment. It happens with breastfeeding, it happens with bonding, especially that maternal child bond is just so important to promote. It's important that we have adequate mental and medical health care. We have a strong safety net to, really prevent stressors in our communities and in our society so that children don't fall through the cracks. We have to promote education and literacy. I mean, one of the things that is most tied to a society's health is when children know how to read. It gives them a sense of control and agency. It gives them a future, it gives them opportunity. So just basic education is just so important. It's important that kids are able to access that and to thrive. So that's a big picture thing here. I think we went through some real neurobiology, which I find interesting. Maybe that was something that you're like, whoa, that goes back to high school or grade school even. But I just think it's important to go back to those basics of how the brain forms and how it's impacted by adversity and stress. But also I'm hoping that it's a message of hope that we are now, I think, tackling childhood mental health, child and youth mental health by really addressing, hopefully, the root causes. And we need to set up some supports and programs and services that really, go away from the more superficial, diagnosis medication type approach and really focus about like, hey, what happened to you? That's why we're here where we are now. And it's different for everybody. Experiences that might, really knock one child off kilter may be tolerated by another child who has good resilient stress and coping responses. So, it's different for everybody. We need to be open-minded and we need to be holistic in our approach. There's many ways that we can help these children. And I think that's the challenge for child and youth mental health. I'll leave it at that. I think I've gone a bit over time already. So I'm open to any questions. I will stop sharing my screen because for some reason, I can't see your questions when I'm actually sharing my screen. So I'll just press stop share there. All right, good. Okay, so I'm just, I've opened my chat here. There's a few questions from those who were unable to be here for the live event. So we've heard that the COVID-19 pandemic described as a mass trauma. Do you think this event has the potential to traumatize our children? If so, what can we do to minimize the impact? So the question is whether COVID-19 would qualify as trauma. Yes, I think our definition of trauma needs to be broad enough to encompass some of the difficulties that we are seeing in COVID-19. The word trauma, I think, traumatic and adverse, maybe adverse is a better term to use. I think sometimes we think of trauma, we think of like, motor vehicle accidents and, more severe events than might be otherwise called adverse. So the COVID-19 pandemic, we know, has stressed many kids, many families. Many families have to deal with not just medical issues. We've seen some of our grandparents get sick. We've seen parents get sick. But the other impacts, the economic impacts on families who have, maybe moved into a poverty situation, the impacts on our social gatherings and our ability to receive support from our extended families has been stretched. We know that relationships have been stretched. We know that couples who were struggling before the pandemic are now separating, and divorce is more common. We know that opioid deaths have increased during the pandemic because substance use has increased due to the stress that has been caused by the pandemic. So the trickle-down effects of this virus are huge. We talk about the first wave, when people got sick, and then the second wave, and then we talk about the impact on, long-term care homes, et cetera. But the fourth wave, that impact on mental health and development and society in general, I think we're just starting to see that ramp up now. Kids not being able to go to school, that just removed so much of their supports. Not being able to see their friends the way they normally could, I think is having a huge mental health impact on many kids. So yes, is it traumatizing? Potentially it can be, definitely for some kids. This might be the straw that really, all of a sudden generates 2 or 3 ACEs that then sets this child up for physical mental health issues down the road. Can you reverse the impact of childhood trauma? I don't think you so much reverse the impact of it as you allow a child to integrate and process that experience and move them from a unhealthy and maladaptive way of having experienced that to a way that allows them to move forward. I think that's different than saying reversing the impact. I mean, the impact is there, the effect on the brain is there, but how do we mitigate the long-term consequences of that effect? We need to have children develop a healthy way of processing those traumatic events and move forward. And that takes a holistic approach, that is reconnecting a child with their culture. It's reconnecting them with their own bodies, being aware of, how they feel, what emotions they're experiencing, teaching a child to express that and to be aware of that is key. And just developing a language around what happened and viewing it in a way that removes any sense of guilt on their part or of a responsibility on their part is just very important for a child psychologically. So it is biological, psychological, social, spiritual, cultural, all these aspects need to be mobilized to help a child deal with their trauma. Are there signs of trauma in a child that a parent should be aware of? If a parent thinks their child may have experienced a significant trauma, what is the first step in addressing it? Well, for sure. I mean, if a child discloses trauma, or if you were there when a traumatic event happened and you know this happened, I mean, that's obvious. Of course, there are situations where children may have experienced trauma, whether at school or at home or in other situations where you may not be aware of it. And you may see a child become more isolated and withdrawn. And in fact, you may see them present with signs and symptoms of some of the other disorders that we talked about, anxiety or ADHD or hyperactivity, or they're just reactive. And we see it expressed as behavior because they're triggered. Little things that shouldn't cause massive eruptions tend to indicate to us that this child is in a state of hyperarousal. And our radar should be up like, hey, what happened to you? Not what's wrong with you. What happened to you? What's going on? And not like we need to dig, but we just need to be open-minded that saying, maybe something happened to this child that was traumatic, whether it's in the playground, bullying, abusive situation. Again, like as caregivers, we should be open to this, and as pediatricians, as therapists, we should be exploring this and allow the child to be able to express what happened to them. That's the first step. Is having that open channel of communication and just be visible and aware. I think so much of this is just education around, hey, this is how the stress response system works. This is how it manifests. Let's figure out, if we see the manifestation of it in behavior, what underlies that, what underpins that. Fourth question, more recently, reference has been made to the potential for inherited emotional trauma. Do these recent studies reflect your own experiences working with children and youth who have developmental trauma? Inherited. Yeah, that's a transgenerational effect that we see. Absolutely huge. This is completely identified in certain populations. I mean, we look at our indigenous populations, minorities that may have gone through terrible suffering in previous generations, and now we are seeing this in subsequent generations. There are what we call epigenetic factors. We know that our genes are altered by adverse experiences, and we have the potential to pass that on, either through how we are subsequently set up to parent our next generation, or even genetically with the genes that we pass on to the next generation can adversely affect that next generation as well. So the transgenerational effects of trauma is huge, and that is why we see certain, why is COVID-19 more harmful and causes more morbidity and mortality in, say, the Black population in the United States and in Canada as well? Because they are more prone to that because of the adversity they have suffered for generations through systemic racism and abuse and societal impact. And so this is a huge situation for sure. And that's why we need to address this on a big scale level. Lisa asked a question, have you heard any recent stats whether the incidence of ACEs have been increasing or decreasing in recent years? Curious, as it seems the family dynamic of today has changed as our societal structures change, changing in job stability for parents, overscheduling of children, etc. In many ways, our world is better now than it was years ago. In other ways, it is not. We are seeing a breakdown of the extended family situation. We are maybe perhaps too focused on the nuclear family, and we should think of we evolved to live in a community of extended family members. In fact, our brains are wired to be nurtured by numerous adults. Yes, we have our most secure attachment to usually our mothers, and subsequently our fathers. And so, but we are actually honed to be healthiest in an extended family situation. And we don't see that as much anymore. We see generally smaller families, less extended families, families being more isolated. Our communities are often set up to be, homes that you don't even really know your neighbors. And so I think our society is becoming more sort of withdrawn in that way. Definitely this varies from country to country, but our social safety net, our educational system is going to be different from one country to another. We know Scandinavian countries have the lowest ACEs. They have a strong safety net. That comes at a cost, of course. As a society, we have to look at ourselves. Is that worth it? And whereas other countries, there's still huge adversity for children. I mean, we look at children coming from some war-torn countries, especially, where there is almost no social safety net. We hear of orphans stranded in refugee camps. I mean, our child soldiers, as I mentioned earlier, in certain war-torn countries. I mean, this is the ultimate in adverse childhood experiences. I can't imagine anything that's going to be worse for that child growing up. There's going to be huge physical, mental health consequences in those children. So those are the two extremes. I'd like to think Canada falls more towards, the Scandinavian model, let's say, as opposed to the other side. But we can certainly do better. And I think certain ACEs, unfortunately, have been increasing. And the more we can do to minimize the impact and to minimize adverse child experiences, the better. I think that's all the questions that we had. It's sort of a broad topic. I wish we had more time to discuss it, but I think that's probably all the time we have for today.
Great. Well, thank you so much, Rob.
No
this was an excellent session. I think a lot of information came out, and as you said, broad topic, but you've covered so much. So thank you very much. Again, I do want to thank Wave Electric, who sponsored today's session, as well as Midland Honda and Brissett Concrete and Forming. Rob is back with us tomorrow at noon to talk about solving problems creatively and collaboratively with children. So what a nice way to end a whole week of talking about childhood mental health issues. So this has been great. Thank you. For the rest of today, we do have some other great sessions. At noon, we have Dr. Anita Federici talking about stress in the workplace. And then at 4, we have yoga with the Yoga House. So we hope you will join us for those. In the link, we did post or in the chat, we did post the link to make a donation to the COVID-19 Mental Health Relief Fund. A lot of people have done so already, so thank you so much. All of these sessions are free, but the funds raised through that donation link are going to help many people struggling with mental health issues and mental health issues that have been exacerbated by COVID-19. So thank you very much. And Rob, thank you again. We will see you tomorrow.
Sounds good. I look forward to it. It's going to be another fascinating topic to discuss. So looking forward to it.
Well, have a great day. Thanks, Rob.